Good evening, all. It's a pleasure to welcome you to our public awareness program, Expert Talk on Management of MASLD and MASH. Our aim is to provide best education and awareness content about fatty liver disease to healthcare professionals and their patients. Today, we are honored to have Dr. Debashis Dutta, renowned gastroenterologist from Kolkata, as a guest speaker. With more than 15 years of experience in the field, Sir is known to provide exceptional care to his patients, and we are grateful for his dedication to improving liver health and educating others about this important topic. So, without further delay, I would like to invite Dr. Devasish to share his valuable insight on management of muscle and MASH. Over to you, sir.
Okay. Good evening, everybody. Thanks to every Zydus groups to give me the opportunity to give some bold speech in front of the audience like you. So now we are very conscious in our scenario. So we are very worried about the recent scenario of the upgrading of the different metabolic disorders like diabetes, hypertension, and also the dyslipidemia, where the lipid profile get altered, and also our lifestyle gradually changes rampantly. Smoking is also there. We are using the liquors and every door to door, and also that we are taking the junk foods. This is our day-to-day scenario, so that we are not obeying the discipline of the life. So what is the background culprit of this ultimate this scenario? This is the liver, and the liver get gradually damaged. And this is the slow damage and the slow gradual progression of the progressive disorder. That is not does always not come into our front, but the metabolic disorders get worsened, and we are going to treat the metabolic disorders like diabetes, hypertension. But the ultimate the backbone of our disorder, this is the liver, from where ultimately scenario goes started. So that we are very cautious of these types of disorders should not come forward and should not progress forward, so that we are very cautious about the main metabolic organ, that is the liver. So initially, there is a concept that the NFALD, non-alcoholic fatty liver disease. That is a very previous terminology, and we are very cautious of this terminology, non-alcoholic fatty liver disease or NASH. But now terminology gradually changes and widened. So why NFLD? But now it comes to the MASLD, very good. But because the liver disease is related with this all metabolic factor, so that why not we are going to accumulate these metabolic factors all together, so that our goal ultimately get completed. So this is very important platform. I am giving you the narration and the give bold steps, so that every public should conscious or aware of these types of illness or disorder of diseases, so that our progression of the disease should be minimized. Now, the 12th June is our very auspicious day already, but the scenario, the celebration is going on toward the public awareness program. 12th June is the MASLD or Mass Day. It is a very important day. We are all over the world is celebrating this day. Now we come to the main chapter. What is MASLD and MASH? Now, next slide, madam. Next slide, madam. Hello. The liver is our prime organ. This is our, I have already told, the prime largest organ. This is the weight around 1500 gram, and also the accumulating on the 5% of the fat. This is very important. Located in the right hypochondrium, upper part of the stomach and intestines. Upper part of the stomach and the intestine. This is the deep light brown color and the soft in consistency. Is a highly vascular organ, highly metabolic vascular organ. Next slide. Next slide. So what are the functions? What are the functions? What are the functions? We are very much, what are the functions we should know the liver? Liver is a very big detoxifying organs, where destroys the old RBC and increase the detoxify the blood, and it from the portal vein lots of intestinal juice comes in the liver, whether it is segregate which part is going to be entered into the system, or which part is going to be consumed, or it is detoxified in our end. This is very important. And also there is a big metabolic organ where the carbohydrate, protein, fats get metabolized and they utilized in the body, and which part has to be secreted to the sent it to the mainstream or which part is going to be definitely destroying at our end. This is very important. And also the production of the bile. Bile is a very good digestive enzyme which is helps in the fat digestion. Very important. And also the some blood coagulation factor which is developed from the liver. This is maintain our coagulability of the blood body. So that every time there is a wear and tear in our system, so that we are bleed in every hour. The bleeding which is in the outside, that is different, but internal bleeding is always going on, but we have to repair at the same time by helping the platelets, by helping the blood clotting factors. That factors are going to develop from the liver. If liver is not in good functioning, that we are in the bleed in every time. So that for this reason, when we are cirrhotic, when we are progressive liver disease, there is the chances of bleeding. That should be taken care in the mind. Also, if there is some alcoholic intoxication and something other intoxication, drug induced intoxication, liver is massively get damaged. So the detoxifying part of the liver is very good, but at one limit. But after at a certain period, liver doesn't take this properly, and so detoxifying property going to come down, and liver gets damaged. So next slide, madam. Now, this is a very important part. We are commonly fighting with this terminology. What is MASLD? Metabolic dysfunction associated liver disease. Very important. Liver is containing only 5% of the fat, but not more than that. Here is a very important point. This part of the fat going to further accumulated. Liver can't load over the over fat. So over when the fat, there is the over fatty liver, there is a lots of scenario going to changes. Liver is not under control to do the proper activity. This is the major important point. This is not related with the alcohol. This is the message is now terminology is that like the non-alcoholic fatty liver disease. Here is the message. Message is not due to the alcohol because we are very much cautious about the alcohol consumption. If you are taking, if you, any person is taking the alcohol, we definitely regret it. But this message is very common in that scenario because this is not always due to alcohol. Non-alcoholic fatty liver disease, non-alcoholic muscle come in the picture. So there's a lots of burning issue in our country and society and the worldwide. And if it not treated properly, and it will convert to the MASH, metabolic associated steatohepatitis. That is the severe inflammation is there. Liver is absolutely burned, absolutely severe inflamed, so that it will ultimately goes to the fibrosis and ultimately goes to the progression of liver disease or cirrhotic changes. So that the terminology MASLD or MAS is very important in our practice in and is a burning issue in our scenario, and the people should very much aware of this problem because we are ignoring our some fat is accumulated in our liver, no issues, sir. So this is not an easy chapter. It's a big chapter. There's something behind that. You are diabetic. You are hypertensive. You are taking. You are a dyslipidemic patient. So that very carefully you should take this issue, and you should ever have this very important. Is a burning issue of the whole population. So that you are overweight, you are obese, you are suffering from diabetes type 2, you are dyslipidemic patient like cholesterol and triglyceride going to rise, so that you definitely some backup picture, there is a message. So you should very much cautious about the message. And now we go to the actual, what is the scenario going to in message. Next. This is very important. Now, the prevalence is there, normal people, you see that this is the normal people not taking the alcohol, not taking the everything, food habit is normal. Still, one in four population goes to the muscle underlying disorder. So that muscle should be taken care very cautiously. And also, if you are a diabetic, out of six patient, there is some incidence of one muscle patient. And also, if it is obese, there is every alternate patient by 10 you can go to the muscle conversion. So that muscle is every year. Metabolic disorder is you should taken care, and these types of illness is going to come down. So that ultimately male gender is very much going to suffer, and the high risk factor for the MASH and fibrosis, because muscle ultimately converted to the steatohepatitis with inflammation and fibrotic changes. Next slide. Now the very important progression we should know about it. You should our left side is our main mother organ, that is the healthy liver, and you should gradually progression is in your slide. And there is, if there is fatty liver, there is accumulation of fat in the liver, and ultimately liver gets yellowing and big size of liver. This is called fatty liver. There is some gradation is also there, grade 1, grade 2, grade 3, like this. If you are not taking properly, this fat accumulation is gradually forms to the scar formation, and there is a fibrotic changes, and the liver get fibrosis. That is means liver get tightened. Initially there is the flexible liver, now liver get tightened, and heart tissue there is a fibrotic changes. Until from this level we can reverse the liver. This is our in hand, the medication in our hand, and the very good medication in our hand. If we do the lifestyle modification, if we go to the proper medication, exercise, everything else. I am coming on the later on. If definitely we go to the retreat our liver to the healthy liver, but if it treatment not going to properly, there is a massive liver injury, massive inflammation, ballooning degeneration, and ultimately goes to the cirrhotic changes. That is, the liver is get sunken, and there is a massive formation of the scar tissue. This is, if there is scar tissue, the liver gradually goes defunctioning, detoxifying property gets lost. Liver is ultimately metabolic function get lost, so that glucose metabolism, protein metabolism, fat metabolism, all goes to come down. There is the bleeding chances is higher due to the lack of albumin formation, so that there is the swelling of the body. Everything scenario goes go. That is called the cirrhotic of the changes. Next slide, madam. Now, this very important part. I have taken the over diet. I have taken the fat. There the fat is accumulated in the liver. Your external belly is progressing. Your body is gradually increasing in body fat. Body BMI index increasing. This is all external picture. But I think for the internal structure, that is a very important. The liver is fat is accumulated in the liver. That is called the steatosis. If there is the inflammation and scarring, that I have already told. If there is inflammation or scarring, this is called the mass. This is called the mass or the severe inflammation. So inflammation is causing the mass steatohepatitis. So fatty accumulation and inflammation. This should be taken care is very carefully. The steatosis will lead to inflammation of the hepatic cell known as the metabolic dysfunction associated with the steatohepatitis, and scarring of the liver, and with the benign changes is called the fibrosis. Next slide. In this way we are gradually what is the causes behind it. I have already told you. This one is obesity. If you are not working properly, if you are not exercising properly, you are inactive, you are sitting posture. Next, also the genetic background. Sometimes genetic background is good. It's a factor where my family is suffering from the fatty liver and some progressive liver disease, and also it goes to in the next generation. You have food intake is not properly. You are not calorie maintained. You are not sedentary activity is very important. There is some metabolic disorder like diabetic, hypertension, other comorbid conditions. You are some exposed to the medication. Very important. You are say, taking some anti. Benzodiazepine groups of drugs. You may be taking the NSAIDs groups of drugs. These are very important for whether the affects the liver, and gradually the liver is damaged. If physical inactivities, I have already told you, is like this. These are all the scenario ultimately leads to the MASLD, metabolic associated steatohepatic disease. Very good factor, and this should be taken care properly in our lifestyle. Next. Now, the very important, we are always, we are accumulating fat, we are eating the very good food from the outside food chains also, and we are taking the lots of food, but we are not going to burn it properly. This is very important. You may take the food, but you have to burn more than that, so that your not fat get accumulated in your system. Normally, 5% fat is accumulated in the liver. Now it comes to the 10 ml, you are become obese, not only internally, externally obese. Now, ultimately, if you are not treated properly, if your not lifestyle is not recovered, then gradually the scarring of the liver and must develop. Uh, Metabolic associated steatohepatitis. Next slide. In that way, we are also the diabetes in our very challenging factor. All you are become gradually diabetic, and it's related with the liver. So that you should taken care of the mother organ. From a mother organ, the ultimate metabolic process is going on. So that if not you cared for the mother organ, you become diabetic. And if your diabetes is not corrected, you become progressive MASLD, and progressive MASLD ultimately goes to the steatohepatitis, and there is the burn and the inflammation, and ultimately the liver failure. So very carefully, you are diabetic, but you think care of your liver. If you are liver disorder patient, you think of your diabetic metabolic disorder. So that both are related. Now scenario. Next slide. Now the what are the symptom? I am suffering from fatty liver disease. Oh, so very minimum fatty liver. We have no not such problem. Actually, this is there is no as such symptom is there from the MASLD or MASH. in progression, but still the in advanced stage, when you are progressive in stage, there is some specific symptoms is also there, like abdominal pain, loss of appetites, you may be nausea may be there, sometimes vomiting also is there. In advanced stage there may be some jaundice also, and continuous and also the some weight loss is there initially, and some also the some blood vessel integrity is not maintained, so that bleeding chances is there. There may be swelling of the foods. There may be water accumulation in the stomach, in the peritoneal cavity, that is called the ascites. Sometimes is flushing and red pump, that is the vascularity of the peripheral vessels, sometimes raised, and sometimes caput medusa, sometimes like this depression also, and some intense fatigue is one of the very common complaint. Your patient is telling us there is a very weakness. That is the prime complaint of the underlying liver disease. In liver disease, prime complaint is the fatigue, prime complaint is the nausea, prime complaint is the vomiting, and cut down is the entire appetite. You are obese, but ultimately goes to the cut down of the entire appetite, because you are gradually progressive in the liver disease. So very careful of this symptoms. When this slightest symptom is there, you go to your doctors and tell that these are the symptoms. Suddenly, I am facing, I am taking the good food, but now I am not taking the food, and there is the big problem is there. Now, next slide. Now, this is very important. What are the diagnoses? This is the actually domain of the doctor. Doctors will do everything. But if you take care in your awareness mind, there is what are the actual thing, so that we can our liver can be kept in good condition. And if there is any silent liver disease, how can we kept in our awareness list? Now, the common blood test we should do for the liver function test. Very important. Liver function test. Number one, you can do the imaging section. Very cheap and best ultrasound is there, and now we are now elastography liver is also the elastic liver function test, and also the fibroscan liver elastography. The way that we see the stiffness of the liver, that is the important imaging section in our hand. If it is not diagnosed in proper way, doctor will go for the liver biopsy. You should taken care is liver biopsy is very small tissue of liver taken care by puncturing of the right hypochondrium in liver weight. So that this is very significant and the gold standard. If we go to the under microscope, and we see that there is the inflammation, ballooning, and also the damage of the hepatocytes is there, so that we can confirm with that there is a progression of the liver damage already started. If these are all failure, then sometimes the CT MRI will be helpful. Thank you. So next slide. Now, the blood test is very everything. Everybody is known to. The liver function is the primary. If the sometimes patient is telling the my SGPT is not going to come down properly, it will be raised every time. So you should think here your disease is progressive, because ALT or the SGPT, this is the if your inflammation come down by treatment, it will come down to the normal level. But if patient is telling this is a continuous elevation of the AST level, so this should be kept in mind. This other factors should be taken care. You are not controlling the other factor, because your lifestyle is not going to properly, your diabetic status is not going to properly, your food habit is not good, or you have some addiction level. It may be non-addicted patient where your sedentary activity, all are should be taken care. In that case, your liver function is gradually improving. Next slide. Now, some score is there. It is practically for the doctor fraternity point of view. These are important. Some FIB4 score is there, and some NFLD fibrosis score is there. These are some guideline we are commonly used. Some ALTST, platelet count. There is some chart is there. If we put the data in our, there is the sometime mobile may app is there. So if we open this app, and some data, we're going to put it over the app, and there is some fifth score, fifth fourth score is there. Sometimes NFLD fibrosis score is also there, along with this BMI, fasting glucose, and albumin level is important. These are all in our diagnostic purposes. Next slide. And the ultimately investigation, basic investigation, ultrasound, but ultrasound is dubious. Basically, we are not using ultrasound in the first line investigation, but sometimes I have to do it, because there is a maximum 25% of the fat should be accumulated in the liver, until unless you are not get the any positive view. So that ultrasound can be that a broad line idea, I have some fat. but is the very dubious test in the sense some laboratory says that there is the grade 1 fat, some laboratory will say the grade 2 fat, some laboratory says the no fat. There is a very confusioning diagnosis in that in my scenario, because if there is if more than 25% fat is accumulated, then MASLD will be diagnosed. So we can go for the next investigation. Next. Now, this is a very unique investigation, transient elastography. That is the fibroscan or the liver stiffness. This is very, very important. When the fat is accumulated, gradually liver get tightened and fibrotic, and scarring is there. So, if there is fat is more than 10%, this investigation is very diagnostic. But it has a unique property: stiffness can be diagnosed or fibrosis can be diagnosed. It has a two values, but it is a very misinterpretation may be there in case of obese patient. Can be obese patient also looks some these types of picture, so that whether it is muscle or obese, that should be taken care by the doctor's intelligence. The next. And also this is the machine, very important. We are also doing in our centers also a very good machine. It has the two parameter is their cap value, that is the control attenuation parameter, where there is how much fat is accumulated in your liver, that will be determined. USD doesn't give you the numerical values, but here is cap value is going cap, or some machine is going the UAP value. So that is the actual what is the accumulation of fat that numerical is given. This machine is a very authentic, so that we can assess the further progression of the disease and by repeated tests. And also there is the LSM value. It's very important. The liver stiffness, how the liver is stiff. Liver is, I have already told you, liver is a very elastic organ. So there is a stiffness is there. So liver is not going to the work properly. So more the stiffness, more the scar formation, more the fibrosis, more cirrhotic changes. So that LSM value is our guideline, so that we can go forward, and we have to treat the patient accordingly. Next slide. Now, the ultimate investigation, but this is very costly, not using in our practice commonly, MRI PDFF. This is a very basic selected for the few centers. This is not, but it is a very gold standard investigation so that only 1%, more than 1% fat is accumulated in the liver. It will be corrected. It will be collected data and they give you the diagnostic information. Next. And now, this I have told you the liver biopsy. Those are invasive procedure, and also the some painful procedure, but it's very 100% diagnostic from the point of pathological, from the point of doctor's point of view also, because the portion of the liver is come as a FNAC or some slide biopsy, slide material. So that will be diagnosed under microscope, and if there is any changes in the liver architecture, we can diagnose them properly. Next. Now, these are the ultimate progression. I have told you we have some fatty liver, non-alcoholic fatty liver disease. That is, I am not taking alcohol any lifetime, but still I am suffering from fatty liver. I have ignored everything. I have leading my lifestyle is not in a proper way. I have ignored the doctor's decision. I take took the medication from outside, and ultimately goes progression with the MASLD, the metabolic deficiency associated liver disease, and ultimately we have. Goes to the mass, or some scarring is there. If the still we are not treated properly, then we become the cirrhotic, and also the from cirrhosis consequences there is severe decomposition. And repeatedly patient are going to admitted with us with the pedal edema, abdominal swelling, albumin slow decrease of the albumin level, and also the some bleeding esophageal varices. All are decomposition procedure. There may be the splenomegaly, and patient is very much in a bad condition. And if it is covered, and sometimes there is the hepatocellular carcinoma or the liver malignancy. These are the very bad consequences, so that we should take care of the pivot level at the mother level, so that it doesn't go in that way. Next slide. Now, the I have already tell this. If you are not treated properly, this is the liver gradually sunken, and ultimately to MASH or cirrhosis or liver cancer is there. Okay, next slide. Next slide. Now the main pivot or main indication, main awareness program now comes. There is a diet. It's a very good. It's diet. We can give you the proper diet. we can give you the guidelines, but it is your hand, your interest, how doctor's opinion I am going to follow. This is a very important. Diet is in your hand, and we have to follow the doctor's decision, doctor's guideline. Number two is exercise. In our present scenario, exercise is very much come down because we are in the homebound job. We are in the using the computer. We are using the AC. We are in the restricted area. We are working, but working is a lot. But I have no physical activity. This is very important. If you are not going to physical activity, you are taking food. Food is digested. Excess additional calorie going to accumulate it in your body. You become gradually obese. You become liver gradually fatty liver is there, and ultimately there is a MASLD is going on. All metabolic disorder are going to engulf at the same time after a few days. So that your lifestyle modification is you should not take the alcohol. You should take the moderate amount of fatty food. You should restrict your smoking also. This is your lifestyle modification, and should take the some junk food, and this is the some saturated fatty acids, saturated fats, and trans fat. You should very much take care. Saturated fat, trans fat is very much take care. This is a very important factor. We are not taking the food from outside, not preservatives. Sometimes carbonated drinks we are also taking. And this is also very bad preservative also, and sometimes the liver is going to damage. And with the silent procedure, silent damage is there. We are not going to ever have this. If not going to ever, and gradually our liver gets damaged. Now, some medications is also there. We are taking frequently some paracetamol preparation. We are still, I am seeing lots of patient coming taking the only 500 paracetamol. That is because the 500 is a very small dose, where the 650 is a very large dose. Why you are going to take the 650 preparation? I am very much astonished. So 500 is the very, I am telling in the every corners of the conference, by every awareness program. 500 is a very short acting and immediate release preparation, so that your liver massively get damaged. Your maybe symptom going to free within very short time, but your liver gets massive damage. So that you should take the sustained release preparation of paracetamol. There is a 650. In case of child below 10 to 12 years, you should take the syrup preparation only 125 or 250 milligram. So you should take not so much NSAIDs. You should take. It may detrimental effects of the liver. Next. Now the combination of the diet, this I have already told you. We have to exercise, we have to plan out the cut down, and the body weight gradually. You just reduce your body weight 3 to 5%. It improves your first line of steatosis. If you want to reduce your weight 7 to 10%, your mass will be recovered. So there is a very important data, all in your hand. If you were just reduce the fat of 5%, your fatty changes will come down. Doctor giving the doctor will give you the good product, best of the product in the market, but still the lifestyle changes and the lifestyle modification and exercise pattern in your hand. You should go the vigorous exercise and cut down your fat 5%, and so that your liver fatty changes going to come down. If you wish to changes the 10%, your the mass or the steatohepatitis, or if there is already scarring of the tissues going on, still there is a chance that you can recover. And along this, your diabetic status come down, your hypertension come down, your cholesterol level, triglyceride level come down. Your all metabolic factor going to be under control. This is the very root cause of your lifestyle pattern. Next slide. So this is all pivot. Just do the some 3% of weight loss, and the steroid is going to control ballooning inflammation. You just if the more than 5%, if you go on to weight loss, the ballooning inflammation come down. Is the authentic data. If you want to the more than 7%, your NAS resolution started. If you are more than 10%, fibrosis. So the doctor, you just cooperate with the doctor's decision. You cooperate with the doctor's advice. You will ultimately go to the healthy individual. Next. This is the Mediterranean diet. This is a standard guideline with every day what to eat to us, so that our liver gets healthy. All of the patient telling us the what are the food we can take so that our liver get healthy. Just everyday preparation. You may just take your snap from this slide. This is a very important slide, international slide. Each day you just take the vegetables, all vegetables. There is no some restriction. All green vegetables, except I have some one or two I am going to add it. Cabbage, cauliflower, very fermenting agent. This may cause the gas formation and also some the bloating. So for this reason, you can reduce in consumption of the cabbage, cauliflower, and also the raw onion, raw chili. I am just discouraging the product. Most of the patient is taking the raw chili, raw onion. That's not good. And you can take the fruits, all fruits allowed, except I am here adding is there. The citrus fruits is not allowed. Citrus fruits is very minimum citrus fruit is the orange, lemon. You should cut down in your diet. Whole meal, wheat product is very important to you also. Wheat product, whole wheat, any types of wheat product, grains, and olive oil is very much even all over world is now working on the olive oil. Initially, we are using refined oil, but I am telling you the olive oil is the best of a choice. Now you take the last MASLD I have also attended from the Delhi. Lots of discussion was over this oil. So now we are recommending only 20% refined oil any preparation. Olive oil you should take the 50 to 60%, and others mustard oil you can do very small amount. So that you can beans and all nuts, legumes and seeds, all seeds, herbs, all plant product you can also take as plenty with no surgery. You can take the weekly preparation yogurt. You can take the fish, egg, chicken allowed in your diet. But as per your convenient, you can take it without any issue. You can take the yogurt in a huge quantity every day. You can also weekly. You can also no such problem if you are capable of collect this product. You can take it. Yogurt as a big source of probiotics and natural probiotics, so that it will helpful of your GI flora also. Now, cut down the red meat. I am telling you, and you can take at least. I better to cut down the red meat, or in case of beef, something beef, lamb. I also the discouraging this preparation because they are if this was prepared by the spicy, this is not helpful, healthy for our body also. Now, you can seafood also. I am discouraging seafood also. Sometimes the guideline says that once a week you can take it without any hazard, but your preparation should be very light and be that should not be very spicy. Next slide. Now, our intention to reduce weight by any means. There is the exercise. We are patient is telling us, I am going to gym, I am going to walk. So here is a very big confusion. So what to do? So my health is not good. So that how can I gym? And one healthy patient will say, no, I am going to gym daily, but still there is a big problem is also there. So now the exercise pattern is different. There is some aerobic exercise and resistance exercise. Aerobic exercise, I think better if you initially is not healthy, if a lean and thin patient, you have some abdominal disorder, you have suffering from abdominal pain. It is better to it is better to go for the aerobic exercise. Better for health. It will initially steatosis will going to come down. This is a very good. This is a reduce your fat, liver fat, and you maintain your weight also and improve the cardiovascular conditions also. Now resistance exercise. Resistance exercise means our liver is get damaged. Liver there is massive inflammation in the liver. I am suffering from the diabetic status. I am there is the glucose absorption is not going to properly. So the insulin sensitivity is not healthy. So that I am become gradually diabetic. Then in that case also some metabolic parameter, abnormal parameter, less energy consumption. In that case, you can do some gym preparation or some weight preparation there. Ultimately, goal from the fatty liver to the normal liver. Next slide. Now the lifestyle tips I already give you in the guideline. So like this is a what just just like Buddha, you sitting in the middle and this lowering sugar intake and to take the frequent amount of milk. You should take your principal meal just you are taking breakfast, lunch, dinner. You are just break the your principal meal in the sixth session so that in between just take the breakfast in between breakfast and lunch you take the small meal and you take the lunch in between lunch and dinner, take the small meal in the evening hours and also the dinner hour. In that case, you take the small amount of feed at frequent interval, regular medical checkups, or you can assess yourself by personally also. If any unusual event is there, definitely contact your doctor. Take the enough vitamins, minerals also they are. Take the your sleep should be very sound sleep, and your exercise pattern I have already told you. Thank you. Say next slide. Now, the very important guidelines of medications, these are also the domain of doctors. This is not awareness program, but here are some guidelines we have also. We have a lots of liver disorder. Sometimes prescription, we are receiving prescription. Sometimes patient is taking the some A preparation, B preparation, C preparation, D preparation. We have some herbal preparation, we have some Ayurvedic preparation, we have some other preparation. I am not discouraging everything, but I have given you a guideline, the standard guideline, which is much more authentic and which is helpful for your health. Unless until your silent disorder will going to progress, you never be at all conscious about it. So that you go for the standard guideline. That guideline follows the all over world and all over the physicians and doctors. So that you go for the INSL recommendation is our in our hand. Three medications is there. Pioglitazone we are also using is very good product, but due to some cardiovascular disorder, it will be not used in at this moment. But if you are a diabetic patient, you were suffering from NASH without fibrosis, sometimes pioglitazone 30 to 40 milligram per day is very helpful to us. And vitamin E is a old standard drug, is a from before our birth is a very good product, good natural source of vitamin E. So that is also used in the NASH or MASH and without fibrosis. But it is a drawback. You should not take the prolonged period. And some diabetic patient and non-diabetic adult is something helpful, but it is not helpful in the diabetic status. And pediatric patient is also sometimes helpful. Still, vitamin E 800 milligram per day is recommended dose. When 400 milligram twice daily, these are the recommended dose. You can take it. Now come to the saroglitazone. This is a big chapter of saroglitazone. It's a very good revolutionary product in our era of the fatty liver and something like this. And these are the very good product, and we are using this for, and it is the reverse from the NASH or the fibrotic changes, and it is also some cirrhotic liver. We are continuously using these types of saroglitazone so that patient our long-term progression can be restricted. Now patient gradually going to improve a lot, and also the some metabolic factors going to come down, and patient is going to healthy if we patient took our guideline of the lifestyle modification like this. Next slide. Now, what are the tips of the fatty liver disease? So already I have told you there is some another some charts is there. We have to quit smoking. We have to exercise regularly. We have to avoid the alcohol consumption. Take the medication properly. Maintain our body weight. We have body BMI also. We have to maintain consumption of the refined sugar and also the carbohydrate. We have to take the balanced diet. These are all very important. We have to avoid saturated and trans saturated fats is very important. Next slide. Now, these are the ultimately goal in our practice. Next slide. Uh, Now here I am going with the total scenario in few words. In general people, we are the doctors. We are giving the lectures about our doctor's prescription on doctor's guideline point of view. Now you the general people. So you are the what are the complaint of the liver disease? Initially, very important part that is very kept in your mind. In liver disease, in liver disease, there is no definite symptom in early stage. When there is progression, because you are in the midway of the liver disease, it gives you the signal. What are the signal? First signal is the fatigue. I am not going to up raise the upstairs. Previously, I jumped to the first and second floor without any hurry, without any problem. Now I have the full breath and I have the some leg problem. I have some cramps because I am not in a capable to the some activity. So that is the fatigue. This is a very important point. Number two, there is the nausea. Nausea is the primary problem of liver disease. Right? That is, I am not feeling well under from under. I am taking the healthy food, not spicy. Still, there is nausea. This is a very significant point. Sometimes there may be vomiting. Vomiting, that vomiting, color of the vomiting, very important. What is the problem? Color is the bile or some yellowish vomiters is there. Sometimes previous early food, can be come through the stomach and the esophagus. That may be also the vomitus. So that is the nausea and vomiting. Number three, rashes is very common. Sometimes female patient come, see the doctors, we are our this area darken gradually. Previously it was looks good, now it is not look healthy. We should take the some ointment. This is not desirable. You think back of the mind, what are maybe the his history? You took the history and what are the actual problem. So that is the stain, excess melanin pigmentation, by abnormal melanin pigmentation, and that is the deposition in the different part of the body. It's a very important point, the pigmentation. Fifth, itching is there, non-specific itching. Patient complaining of the itching of the over the whole of the body. You go for the anti-allergic. Never do like this. Anti-allergic has a very dead effect over the if there is underlying liver damage. Anti-allergic has a further progress the damage or exacerbate the damage process. So that something behind that you should take care. If advanced stage, if advanced stage, patient come to you without any symptom, patient come to you pedal swelling. There's a bilateral swelling of the foot. It's very important. And also gradual swelling of the abdomen. This is very important. So the decompensation process started. Sometimes patient comes to you, there is the anemia or my blood level, hemoglobin level gradually come down. Now, just 2 to 3 months before, I have the 10.5. Now it will become 6.1. You give your the iron preparation. After giving the iron preparation, there is the stool again black. So that is the obscure of the actual diagnosis. You should taken care in the mind whether there is a liver damage or not. Because I have told you already, the platelet has been generated from the liver, all blood clotting factor from the liver. So that is deranged gradually. So that there is a bleeding process started. Initially, there is a microscopic bleeding. Where from the bleeding started? It can go through the any organ. Intestine is the primary site. Stomach is the primary site. Esophageal varix may be there. From there, maybe droplets of blood bleeding is there. That bleeding come through the stool. That is digested, and ultimately stool color doesn't change. But gradually slow release of the loss of the hemoglobin, loss of the blood causes the lowering of the hemoglobin level. That may cause nutritional deficiency. That may cause hurried respiration. That may cause pedal swelling. Number three, that bleeding may be pronounced in case of advanced disorder. In that case, there is the red stool coming through the rectum, and also there is the vomitus that is called the hematomesis. There's an acute emergency condition. In case of very emergency condition, there is a decomposition stage. So that these are the scenario. You have to taken care in proper way because bleeding is there. So all cause behind behind the scenario there is the liver. So that we should take care in that way. So patient, what to do? These are the symptoms patient is normally present to the doctor, but this is a very late symptom. So for the point of patient, my liver is not good. I I understand. By how can we prevent my liver disease from our end, from the end of the patient? It's very important. You do your exercise every day. You go the steps at least 400 steps per day, or if you wish, increase 300 steps per day. Minimum 1 hour walk, plain walk. No gym necessary. If you are capable of go plain work, you go to the local area, go to the for 1 hour exercise. If there is the not possibility, very conservative family in female patient, they are not going to big problem. So I have my practice told the patient, go to the your rooftop and then walk. If there is no rooftop, if the small flats patient, they are now there is the small flat is there, you walk in your room also from either 200 either 200 so that it will come through the 400 steps. So that is that you should move every time. That is very important. Exercise in your hand, food habits in your hand, healthy food habits in your hand. You take the fresh vegetables, take the fruits, fresh fruits, you take the probiotics, you take the high fiber diet, You take the adequate water, you avoid the refined sugar, you avoid smoking, you avoid alcohol consumption. Carbonated health drinks should be avoided. Junk food, complex carbohydrates should be avoided. That is your hand completely, not in doctor's hand. Your liver, your asset. You can live with your healthy liver. Now, number four, stress anxiety is a very dead effect over the liver. If you are ultimately stressed every time, you not going to notify your liver how much liver is going to damage gradually. So you have to stress factor, you have to come down properly. Nighttime sleep is very important. If you are not nighttime sleep, your brain is cortisol is secreting from your brain, and there is massive liver damage and vasoconstriction, vascularity come down, compromised, and there may be lots of event may be there. So that your stress, anxiety cut down by how you can meditate, you can pray to the God, you can some proper medication, proper meditation, you can do it. For this reason, you have to stress factor going to come down. And another, taking the painkiller or taking antibiotic, not over the counter without doctor's prescription, because you are taking the antibiotics by your end, you are taking the painkiller from the your end. You never know how much damaging that is the for the liver. So these are the healthy habits, healthy foods, healthy diets, healthy medication you should take care in your mind. And what are the findings? Repeatedly, you are only minimum 6 months interval or in 3 months interval. You should check your weight. You check your BP or pulse, blood pressure. You can check your also BMI index, and also some basic investigation. There are not a lots of investigation necessary to diagnose the liver disease. You do the liver function test one every 6 monthly liver function test with SGBT, SGOT level is very important. And if you are alcohol drunkard, there is a gamma GT is also significant. You can do the cholesterol triglyceride so that your fat level is gradually increasing on it. You can do the blood sugar level. These are all 2 to 3 parameters will give you the proper guideline and go to the doctors. Any doctors who are those who are treated like a treatment giving like on these parameters, they will give you the proper guideline. And so if you go to the some progressive disorder, you go to the fibroscan or liver elastography, so that how much liver going to stiff, or by the preparation or by treatment of the doctor, your liver whether goes to the normalize or not. These are all very important and very important guideline I am giving you. These are all subjective guidelines, and I think you will be benefited over this lecture. And you, if you want to record these chapters, and it will be ultimately helpful to you. Yeah, definitely, we are enjoying our life. Sometimes we took the alcohol, sometimes took our spicy junk food. I am not discouraging everybody all time, but every time you are taking 7 days to 5 days in a week, you are taking some junk food, taking some carbonated drinks, taking some preservative, taking some food, processed foods. This is not helpful. And this will be a burden in our society, because your health is our main concern. Our concern, we are doctors treating you. We are doctors always working to keep your life healthy. And so that if you are healthy, whole universe will be healthy and our society will be healthy. Thank you.
Thank you, sir, for such a wonderful talk. So, with your permission, we would like to hear your thoughts on few questions that we received from audience.
Okay.
Sir, how common MASLD and MASH in Indian population?
Actually, incidence gradually increasing. If you have percentage of data, we are just recently percentage of data,
Yeah.
23% to 31% in Asian scenario, the MASLD and mass are gradually increasing. If you compare with the Western country, there is 21 to 25%, but in the Indian scenario, Asian population, the very much awareness is lacking. For this reason, gradually is going on, because rampant increasing in the diabetes, hypertension, dyslipidemia, and along with the mass in increasing in our eastern zone, that is our Asian country. Is the 23 to 31% is the percentage of basis gradually we are suffering.
Okay. Sir, MASLD and MASH be age specific?
Actually, now childhood obesity is very common in our country and in our society also, because of the affluence of our society. Childhood concern, we are very much we are not bothered basically, because for this reason I am in my practice I am receiving lots of patients who is coming from the childhood obesity. In that case, childhood SGPT, SGOT, and sometimes alkaline phosphorus is going to increase, and sometimes different liver silent liver disease is there. So so incidence, predominantly there is a male population mainly sufferer, because they are, but ultimately now female population is going to rising, because initially female population is not so much homebound, basically not going to active properly. Now the scenario parallel going on, so that they are coming, the working people, women, they may be some going outside and took the ready-made food. And sometimes alcohol consumption is very much common in the female population. They are taking the smoking also. For these lifestyle changes, the parallelly male female going to increase, but female definitely male people population is definitely much more prone to the MASLD or MAFL preparation.
So, now, on behalf of Nash 24 by 7, I extend my sincere thanks to Dr. Devasis for his enlightening and engaging talk on MASLD. Sir's insights have highlighted the need of increasing awareness about fatty liver disease. I also want to express my appreciation to our audience and stay connected with Flash 24 by 7 on Facebook page for upcoming updates and information. Take care, stay well. Thank you so much, sir, for joining us today. Thank you,
Okay.
everyone.
Thank you.